Welcome again. This is Good Morning Anambra discussion segment. Good to have you here. My name is Sijama. How are you?
Very good. Of course, I used to do now newspaper discussions where Buddha Kita knows in the proper Marcia proper, but or another segment of the Good Morning Anambra by the who Maka Ifaiji Makia Yata.
Adema. And then the topic of today is promoting eye health and access to vision care in Nigeria. And this is to commemorate the 2025 World Sight Day, which has its theme as Love Your Eyes. Of course, the celebration will take place tomorrow, but we just want to put you on your toes to get ready for what you should be expecting tomorrow. Okay, good to have you here. How good is your eyes? Don't mind this. I have a good eyes.
Yesterday, I found out that it's actually a serious issue. We have about 2.2 billion people globally with eyesight issues, whether it has to do with nearsightedness or farsightedness. Then I've got issues with glaucoma. Glaucoma is a very serious issue. I think about 80 million people with issues with glaucoma. So, the fact I get more Yotago.
Well, sometimes some people will be wearing eyeglasses, but it does not necessarily mean they have problem with your eyes. I'm not taking excuse for myself. Like I can do very well without the glasses, okay, but not when I'm looking at something very far. All right, let's move on. We'll have professionals. We are presenters, so we don't have a good idea or authority over this kind of discussions. That's why we gathered some professionals to look at this, because it's a professional area. So we'll have the first person here, Dr. Glad Azubike. She is an optometrist. Good morning, Dr. Glad.
Good morning. Good morning. Thank you.
Okay, I also have Dr. Clara Okeke, Financial Secretary, Nigerian Optometrics Association, Anambra State Chapter. Good morning, Dr. Clara.
Good morning, madam. Good morning, everyone.
I must say that you two are looking good. Okay, and I'm glad it's not with eyeglass. You give us and you don't use. That makes you lucky.
Yeah, I don't have a refractive error for now.
Okay.
Yeah.
All right, you're welcome. Yes, you heard our intro, so let's look at this. How many people did you say that are suffering from eye problem?
About 2.2 billion globally. This is according to reports from the World Health Organization and also the IAPB, that's the International Association of Prevention from Blindness. Yeah, so of course. So it's very important to also note that according to reports, this was first celebrated sometime in 2000 in partnership with the World Health Organization and also the IAPB. So what would you say was the major reason to actually have a celebration like this? Why is it so important? Dr. Clara.
Okay. Good morning. Thank you very much. From your statistics, yes, accurate. And aside having visual impairment, it was discovered that out of the 2.2 billion, 1 billion visual impairment could have been corrected accurately if these persons sought for proper care. So the reason for this celebration is to create awareness, proper awareness for people to maximize or prioritize their eye health, to look at, make vision care accessible, affordable, and then it should get to even especially undeserved communities. It's a time where we call out people, the general populace, stakeholders, private sector, public sector, everyone, all hands should be on deck in order for people to prioritize their eye health. Because like he said, the eye is the lamp of the body, and if the lamp is unhealthy, then the whole body will suffer. But when the eye is very healthy, then the whole body will be full of light. This is also scriptural, and at the same time, it's practical and medical. So the main point of this awareness is to prioritize our eye health for everyone to take, not just for this season, the World Sight Day is tomorrow and the celebration throughout this week, but then it should be in everyone's consciousness that eye health is something everybody should prioritize. How healthy are your eyes? What are you doing to ensure that you are maximizing the vision you have been given? What are you doing to see that you're taking care of your eyes effectively? What are you doing to see that you enjoy good vision throughout life? So this is the essence of this celebration, to create awareness to the general populace and everyone at large.
Very
for
important.
eye health.
Thank you very much. Okay, yeah, Dr. Glad, let's come to you. What are the leading causes of blindness and poor vision in Nigeria today? We have given statistics of what it looks like in the whole world. So let's come back home. And then how many of them are actually preventable, like Clara said, that some of these things, some of these figures are preventable if we had come on time. So what are the causes of these eye issues?
Thank you very much. The first one is cataract. Cataract, is when the lens becomes opaque, that light will not be able to pass through the patient's pupil. Yes, that is what causes it. Then, when a patient has cataract, we can do a surgery on the patient so that the patient will start seeing again. The surgery is when you remove the lens the eye came with, and you will insert.
Okay, before we get to that, we want to find out, now that we have mentioned cataract, what causes it? Are people born with cataract?
Yes.
Is there any kind of style, lifestyle that causes cataract?
We have congenital cataract for small children that are born with it.
Okay.
Yes. There are some drugs that when you take it, some medicines that when you take it excessively without doctor's prescription, it can cause it. Old age can cause it. Hypertension, diabetes, it can cause it. Yes.
Okay, so.
You were saying something previously about cataract, trying to give a detailed explanation of what it actually is. So, something Dr. Clara was saying about, eye defects and the fact that they can be curable, if attended to on time. All right, so can you give us, can you expatiate on that?
Okay. Cataract is normally an age-related problem for people that are old. When you start becoming old, every part of your body starts depreciating. This is for elderly people. That the lens is not excluded. The lens also depreciates. And when it depreciates, you find out that your vision is minimized, that you won't be able to see again. So that's when we refer you for a surgery where the lens is being removed and an artificial lens is being placed so that the patient will be able to see again. Yes.
Okay, before we get proper to how to handle this thing, let us first of all establish where we have these problems, and how it comes about. Dr. Clara, we have cataract, we have glaucoma, we have refractive errors, So what early warning signs would Nigerians look out for to say that, like you said, that if you present this matter early, it will be prevented, or it could be just handled and then it will go?
Okay, thank you very much. That's why one of our slogans in eye care is early detection. Early detection helps save lots of troubles. Now, when we talk about signs and symptoms, in most cases, there's usually damage has already begun. In cases of glaucoma, when the person begins to record probably blurry vision, cloudy vision, you find out that already some amount of vision are already being lost in that person. So that is why we talk about early detection. That is why these avenues are created That's why we make this announcement. We reach out to people to go and have their eyes checked. Usually, we advise that people check their eyes twice yearly without people with unknown, with no known eye issues. You shouldn't wait till you begin to have the signs and symptoms. Now, in cases where people didn't make the best opportunity of going for eye test before these things come on, you can have things like blurry vision. People complain of it. I can't see very clearly. People have red eyes. Now, these things do not narrow down to just a particular eye disease. It could be a myriad of eye diseases. In just like red eyes, it could mean a lot of things. It could mean conjunctivitis, it could mean glaucoma, it could mean uveitis, and the rest of it. Now, we also have people recording tearing. Their eyes are bringing out water. They try to read. They try to perform their daily activities. Tears are coming out. Now we have other people itching. You know, people think that itching is just ordinary thing. And my eye itches me, of course, it's normal. It's not normal. It could suggest serious eye issues. You could have also headache, ocular headache. Any headache around the eyes. The eye is paining. The eye, you're feeling as if the eye is a peppery sensation. You're feeling as if your eyes are drying out. You're feeling as if your eyes, you're feeling drowsy. A lot of persons, it could be ocular fatigue, suggesting a bigger problem. You could have people having strains around the eye. People have already, sometimes they complain of the eye pulling them. Eye heaviness. These are a myriad of symptoms that could suggest severe eye issues. We also have people complaining of insomnia. We have had this, you see that is linked to some eye issues. Yes, insomnia. Because of the headache, because of the eye heaviness, because of the ocular symptoms associated with this eye issue, this person will find it difficult to sleep. So we also have people underperforming with their daily activities. Children in schools, they don't see the blackboard, they report to their parents. See, what my teacher is writing, I can't see this thing very well. Some people skip letters. They are reading, you think that maybe intentionally, they don't know the letters. They didn't see it, they skip letters. Children also, they skip while copying their notes. You see some other persons, their eye can be pale. These are already in severe cases. When it begins to manifest on the eye, you look at the eye, it could be dull, it could be pale, it could be reddish, and a lot of other symptoms. These things are not limited to these things mentioned. It could be more. But this is for us to be very sensitive and careful and watchful to be able to note what is normal. Every normal eye shouldn't have any problem at all. If you begin to experience anything aside the normal, anything that disturbs you, anything that distracts you from, being very productive throughout the day, this could suggest that there's an eye issue already.
So all these signs and symptoms you have just mentioned, are they just linked to only cataracts and glaucoma?
No, not entirely. Just like these are just two of the most myriad of eye diseases. In children, we have recorded uncorrected refractive error. This is one of the major eye issues that are causing children in Nigeria, in Africa, to underperform in academic activities. Unrefractive corrected error, what does it mean? The child is not seeing the board, is not reading effectively, is not seeing well. This child could be attended to, probably through glasses or refractive surgery, and the child see. Then there are other ones. We have what we call trachoma. These ones are in villages. We have onchocerciasis. We have age-related macular degeneration. These ones are with the elderly. You find that these are diseases with the elderly. Now we also have the common one, because of the use of gadgets these days. We have a computer vision syndrome or digital eye strain.
Can you tell us more about that one?
Okay.
How does it, what are the signs and symptoms of that one, that you have started having problem because your eyes is always on your phone?
Okay, now see, because we are always, most of our activities these days, we have to do with the screen. Now these screens emit radiation, and the eye is one of the structures that are not covered by skin. Now this is what happens. people that use this system always, they could have what we call dry eye. Dry eye, or what we call keratoconjunctivitis sicca. Then in severe cases, you find out that these persons experience blurry vision. The blurry vision occurs because of the drying out of the eye surfaces. That's why we encourage everyone that uses gadgets, be it phone, be it laptop, any form of screen at all. You blink often. You blink. This is to make sure that the eye surface is well lubricated, so that light comes in and then the light is able to focus very well. So there are also cases of pain for use of screen. That's why most persons use glasses, not because they are not seeing. Protection, eye protection from these radiations with screen. Then there are also cases of headache from this digital eye strain, that when properly taken care of, then these problems go away. Now, it all depends on the person using it. There are other things aside the treatment. There are eye exercises we encourage. We also encourage hydration and the rest of it, so that the person will have less disturbances with this screen. And in the long run, it doesn't lead to other severe problems on the eye.
I see.
All right, let's look at the situation very much linked to, let's say, African Americans and also the Latinos. According to reports say these are the people most affected by eye defects. According to research, it's mostly have to do with Black Africans and also Latinos. Dr. Clara, what is it about this report that eye defects are very much connected to Black Africans and Latinos? Why is this rampant amongst them?
Okay, the weather is part of it.
Okay, the weather.
Yeah, the weather is part of it. And the nature of their eye. Their cornea, the way it is part of it. Yes. So we in Africa, we are more opportune, the way our eyes are. We are more opportune, at least when the light comes in. You know, their cornea, most of them, if you see their cornea, our own is brown. Their own is somehow bluish in color. So it's not able to emit light, but ours can very well.
So back to Nigeria, what are the efforts being made, by optometrists or agencies like yours to properly educate more people about, eye defects?
Okay, that's why we do this awareness. We go around sensitizing people. Like yesterday, we did one at Amako. You sensitize them, tell them the need of them to always visit the eye clinic at least twice a year. So that, once we detect an eye problem, we move into action to prevent blindness. But when you don't do that, and the cases, lingers, the probability for us to intervene, yes, is very less. But when you constantly visit, like glaucoma, when you constantly visit and we check your IOP and the IOP is high, we start giving eye drops that will help curtail it. Because when a patient has glaucoma, we manage. There's no treatment for glaucoma. So we manage. So when you start using that, your eye drop, and you constantly, once a month, you come, we check your eye pressure, and you continually use your eye drops, that is when there will be a limit to the damage that will be caused.
We're talking about, you say when they come, are these medications free, or they are going to be paid, but at a subsidized rate, or where is this?
Depending on the area.
Okay.
Yes. If we move into villages, we can give them for free. Yes, we can subsidize. We can charge equally, depending on the patient.
Okay, depending on the patient. When you're talking about we, are you talking about practitioners, talking about optometrists or ophthalmologists, or your body as a whole?
The body as a whole. Yes.
All right.
Okay, Dr. Clara. Yeah.
Also, additionally, to what she said. Previously, there have been programs from this World Side Day, like last year was Love Your Eyes. The spotlight was on children. So we went to schools. The Nigerian Optometric Association, they made provisions for glasses, for outreaches to schools, to villages. Now, for this year, there has been program one. The program has been mapped out. The work for sight is there, and there are provisions where we are going to have a free medical treatment, giving free glasses, free treatment, like in Oka here, we have the correctional centers. And
Okay, that's for this
also,
year. We are coming. You're going to tell us your activities for the day, but let's first of all get what is the problem with our eyes, and then what we need to do to prevent coming to you to ask for glasses and all the things we have packaged, and then that will minimize the expenses for you too. Let's talk about, we have talked about cataract. Let's also talk about this glaucoma of a thing. What is the cause of glaucoma?
Okay. Glaucoma is a group of eye diseases. It is a group of eye diseases. Now that have, yes, because we are not just looking at one thing now. It's a group of eye disease that damages the optic nerve. The optic nerve is the brain, where the retina is the brain of the retina at the back of the eye. So this disease targets this brain and begins to damage it. And once it begins to damage it, vision begins to get lost. And we say that this person is already losing vision. Now you're coming to what causes glaucoma. Now, medically, you have a group of things we can point out. We can actually say this is exactly, because it's a group of diseases. And then there are also risk factors that makes some certain persons suffer these diseases more than others. We look at the issues of congenital glaucoma. People are born with underdeveloped eye tissues. Children, we have had children that are born. The tissues in the eye didn't develop properly. It could be due to drugs taken during pregnancy, improper care, or it could be just due to underdevelopment. Maybe the cells didn't divide the way it should be. So these children are born with this disease. We'll say this one is born, it's congenital already. Now we have cases of family history. That's why we tell people, be aware of your family history. In the olden days, they usually ask this family, before they get married, do they usually suffer eye disease? This is where we are coming to. Family, yes. And if we address, now it happens because glaucoma can be passed from a generation, even to up to a fourth generation. Yes, up to fourth generation. Could be great-great-grandfather had glaucoma. It could pass to maybe great-great-grandson, the third generation, the fourth generation. So there is issue of family history. Now, there is also issue of systemic diseases like diabetes, hypertension, and a group of other diseases. And there is issue of drug abuse. Drug abuse, there are drugs people take over a long period of time. It predisposes them to having glaucoma. So the drug is there. Then there's also issue of lifestyle. Lifestyle. That's why we talk about encourage people intentional living, intentional eating, in order to narrow the risk of having these diseases.
So what are these things that usually need? What are these lifestyles that that may actually encourage eye defects like glaucoma and everything?
First on the list is traditional practices. Traditional practice is what people do. They put in all manner of urine, herbal things, products into their eyes. They use sugar solution. I've heard salt solution. They put this thing into their eyes. Probably maybe when they have this itching of a thing. Some people put rub. Some people herbs. They go to the bitter cola, different things. These things can cause glaucoma. It can even cause more severe eye. You can damage the cornea and lead to total loss of vision. Now, then the second thing of the diet, now we encourage people to eat lots of fruits and vegetables. Very, very well. Now, the issue of, we advise quitting smoking, because all these things increases free radicals.
It's about all smokes or
any smoking at all, we don't encourage it.
Because sometimes when you tell people quit smoking, they say, oh, okay, we won't take cigarettes, but we'll take shisha.
Every
we won't take shisha, but we'll take marijuana. or other forms of smoke?
No, we don't encourage because this thing increases. One, it reduces the body, the good radicals, what we call good biotics in the system, increases free radicals. These are nonsenses in the system that could make the person prone to having these diseases. Alcohol tea is there, excessive of it. It's good. There has been some little relationship established with alcohol and glaucoma. Now, there are issues of people with severe short, in layman's language, severe short-sightedness. They are predisposed to having glaucoma. People that don't see far, in severe cases, especially when it progresses, these things can, you say this person is at the risk of having glaucoma. Now, we have also mentioned that about the gadget thing. Now, people, these things can contribute, not mean that it can directly cause, but it can,
cause,
yes,
it can
contribute.
That's when there's elements of this, and
In
then
this
one
person,
enhances
yes,
it.
yes,
Okay.
it can contribute to this group of eye diseases that results to glaucoma.
Okay, cataract is not treatable. So what do you do when you have glaucoma? Is it treatable?
Okay, glaucoma, just like we have said, we refer to it as the silent thief of sight. So the biggest remedy for glaucoma is early detection. It's more like a management eye disease where this group of diseases that damages the optic nerve can be managed throughout life, and this person can have good and sound vision throughout life. It can, yes.
Really?
Yes, glaucoma can be properly managed.
So it's only cataract that you can
Operate on.
remove.
Yes.
But
Now there's other form of glaucoma where we recommend surgery. Just like he mentioned earlier in Caucasians, where they have a type of glaucoma called closed angle glaucoma. There's kind of surgery. That is the angle where this fluid moves into the eye is blocked or something. Now they can have a surgical excision there and the fluid. That does not rule out the entire use of drugs. The person might still use drug. Even in open angle glaucoma for children, there has been some recent treatments, laser, where they can reduce the impact of the glaucoma and use drug to manage it throughout life.
Voila.
So it's a management. It's a management.
Okay, no, we're going to take a break here to call for that street walk, and when we come back, we'll now get into the activity of this year's celebration proper. We'll talk to some people on the streets. Let's hear them.
It is very necessary for us, for the people, to take good care of their eyes, because if you don't have eyes, you know that you lose everything on this earth. So it is very, very important for us to take good care of our eyes.
Important because we cannot move around with our eyes. When we have our eyes defect, we cannot move freely. We'll be needing other people's help in order to walk around or even attend to your children. Even at your workplace, it may affect.
Yeah, it's very necessary. It's very good. To check such a thing is very, very nice. Like eyes, and even not only eyes, check yourself. Go for medical checkup to examine yourself to know what is wrong on your body. So continue treating it in time.
It's good for us to take care of our eyes because we need our eyes. When you are not seeing anything, you can only identify by voice, which is through your ear, and it's not all that good. So it's very necessary for we to take care of our eyes. Be it what, you have to find solution. According to the lectures here and there, I understood that that you don't need to leave soap to enter your eyes. That is for us to know that our health is number one. Because if you don't have good health, you cannot do anything. That's your business that you are posting as number one. You cannot do it as you don't have a good health.
We should take care of our eyes by avoiding anything alcoholic, anything that can cause harm to our eyes. and something like mkpurumiri and the other things that can cause problem.
Yes, for avoid kind of, because if you know the eyes no there, okay, no go move motor, no go anywhere, no problem. That's the whole problem. You're supposed to eyes what good and check off for a hospital all the time. Okay, we should avoid all this modern makeup like putting on eyelashes because of the chemical they are using for it. Then another one, constantly cooking with charcoal. We should reduce the rate we are cooking with because not everybody can afford the gas. So those people that are using charcoal, they should reduce the rate they are using it. Some of our women use their mouth to blow the fire. Pooh, pooh. They should avoid it totally. Instead, using hand fan.
Depends on your field. If you are a mechanic, you don't allow fuel and other things to enter your eyes. Okay? If you are a sportsman, you don't allow someone to hit you. Okay? To hit your eye. Depends your field.
You have heard people talk about how to take care of their eyes, and you too should know how to take care of your own eyes. That's why we have these professionals talking to us this morning, talking about Dr. Glad Azubike and Dr. Clara Okeke. We welcome you again. Now, let's get into why we are here proper, okay? The 2025, what do you call it? World Sight Day, isn't it? Which has its theme as Love Your Eyes. We've been talking behind the scene about our eyes. That's to show you how much you love our eyes. If you don't love your eyes, what part of your body will even love more?
It's quite depressing.
Honestly.
I had an uncle who died basically due to the fact that he couldn't see.
Yeah.
He could feel the depression and all that.
Honestly.
He did everything actually. He flew him outside the country to get he still couldn't.
The depression, the fact that he couldn't see.
Detection and all that was quite. So we saw him shrinking, and that at a very young age.
Too bad. Honestly, ndi was na isi udoloya. Whatever I mean by that, I don't understand. Okay, because I just said it now. One time you mean. Odema, let's continue. Well, tell us about the preparation. But today is Wednesday. You can speak Igbo to us. So, and I got a fan. Tell about your preparation for this year. Let me start with you, Dr. Clyde.
Okay, thank you very much. What side day we started yesterday to sensitize people. Like yesterday, we went to the immunization section to sensitize mothers with children on how to take care of their babies' eyes, equally their own too. You know, we noticed, I've seen some cases that came, maybe their children has red eyes or discharges, and they will tell you, we used the early morning urine to, instill the baby. And I will be like, why? Who told you? What if there's an infection in that urine? Meanwhile, urine is a waste product. So how come you will instill it in your baby's eye? So we had to sensitize them on the need to visit the nearest optometrist so that the baby's eye will be properly examined and the proper eye drops will be given to the baby. And, yesterday they were happy. And we also told them the need for them to quickly run to an optometrist for proper eye care. We also noticed that, most patients, once they notice maybe with itching, blurry of vision, their first point of contact is the pharmacy. And they give them the wrong eye drop. And when they come to the optometrist is when the case has worsened. And you see them come. And at times they come and there won't be any remedy. The eye is gone, is that the eye is gone. We won't be able to do. So we sensitized them yesterday. And tomorrow we are going to be visiting the correctional center to equally, do a proper eye check on them because I know that where they are not getting it. Last 2 years we visited them and we equally did a proper eye check. We'll be going with free glasses, free eye drops. If it is one that we cannot, because we are not going there with all the equipment, we'll now refer. Then on Friday, we continue with sensitization to health centers. We will equally go to motherless babies' home to equally check their eyes. People that are less privileged will go to health centers that are in villages, people that don't have proper, eye care management, access to health care. Yes. Then on Sunday, we'll do our Thanksgiving.
Oh, beautiful.
Yeah.
Yes, Dr. Clara, let me come to you. You mentioned some places in Oka while we are off the camera. Can we know where to go and check our eyes as this promo runs?
Okay, we have some clinics, eye clinics that are partnering with the Nigerian Optometric Association to offer free eye check for individuals in Oka, not only in Oka, in Onitsha too, in Anambra and its environs. In Oka here, we have clinics like St. Odelia Eye Clinic. We have
Where is it?
St. Odelia Eye Clinic is at Divine Shopping Plaza at the Immigration Junction towards Agoka.
Okay.
Then we have the Bliss Eye Clinic. It's at Opono. This is a Y Junction area.
Okay.
That Y Junction area. Then we also have the Awesome Eye Clinic. It's at opposite the old Radopin, 6th Avenue, opposite Radopin, close to Ekoka or close to the EDC office. Then we also have the Oka Eye Clinic. It's situated at the Regina Junction, the old road of Regina Junction. These places you can walk in throughout this week and have your eyes checked for free. And then you can also get some treatments in cases of maybe needs of eye drops or glasses, especially for reading and doing near tasks. You can get these things free. Yes, all for free, courtesy of the Nigerian Optometric Association.
You want to finish. Okay, let's hear the places you have it in Onitsha too, Newi and other places.
Okay, basically in Onitsha we have the Identity Eye Clinic. Identity. In some of these places, I'll have to go through the address so that I'll be able to.
We'll give you time to go through, and then you tell us why. Dr. Glad will also tell us what we are expected to gain from this week's celebration. Okay, this year's celebration, which by extension is this week. When is it proper? When is the celebration? Is it today? Tomorrow. So what do you expect? Are we going to eat as well? Any rice and strawberries?
We're going to do a proper awareness.
Okay.
Yes.
Apart from those places you say you're going to visit, are you going to do it? Is there a road walk?
We're going to do a walk for sight on Saturday.
Beautiful.
Yes. We're going to be starting from that Amobia roundabout Oka, sensitizing people on the need for them to take care of their eyes.
Right. Let's also look at partnership with the government or collaborations with the government. Have you been collaborating with the government? Have the government been partnering with you to actually probably enhance some of your activities, or probably also subsidize some of the eye gadgets, we like call it gadgets, or some of the talking about the glasses and all that, because one of the issues you find out is the fact that people are afraid of going for checkup due to how cost intensive some of these things are. So what will you have to say about that?
Okay, thank you. To an extent, there's a subsidization, but we still plead for more, especially for people in the rural areas that don't have access to a proper eye care. Just like you said, some people are afraid of approaching the eye clinics because of the financial part of it. Yeah, so we encourage government to, if they can set up eye clinics, take more doctors, employ more eye doctors, optometrists, to put in all the health centers in the villages, so that the people there will have an access to the doctor there. Yes, so that is what we are pleading. More employment for optometrists in all the health centers, in all the local governments of Anambra State and beyond Anambra State. Yes, this will help curtail the increase of blindness.
Okay, thank you very much. Let's look at some of the challenges that you guys face and see how we can tackle it. I know some people that will just have eye issues and they will get to the market. When I say market, open market like that, where they sell glasses, to go and ask them to check their eyes and issue them glasses. Dr. Clara, do you know that something like that exists?
We are aware.
So tell us, how do you feel about, have you seen what you're looking for?
Okay, yes.
Okay, let's first get this. And then
Okay, the Identity Vision Care Clinic is at Ibuku, number 8, Ibuku Francis Street, off Post Office, Onisha. That's the one at Onisha, Identity. Now, for the villages, we have a clinic at...
Only one in Onitsha, and you have
For
four in
now,
Oka.
for now.
Ha,
Hello. Then for the village, we have at Isu and Ocha.
okay.
Sima Vision Clinic is at Isu and Ocha there. This one is by the road. Once you get to Isu and Ocha Junction, you'll be able to find the place.
Okay. No, none at Newi, Ibuku, Ekulobia.
In infrared areas too,
Yes.
places like now, these places are very much visible.
Yes, we still have plans to reach out to them, especially these places you have mentioned. That's why we are calling for more support
Okay.
from stakeholders and the government
Okay.
to be able to access these places.
All right. So let's see some of the challenges you are facing in your profession.
Okay, one of the major challenges we face here is quackery. The quacks. We have them a lot in the marketplaces, in churches, especially in the grassroots, in the villages. You have these people, they come in with promises of one herbal drug will take care of 10 eye diseases at the same time. We have seen people say they offered that these eye drops, just use it, and then glaucoma is gone, cataract is gone. And how come medicine have not been able to have a breakthrough just with one eye drop, taking care of more than 15 eye problems? So we have the issue of quackery. And that is why we are creating this awareness that people should know that it is very wrong to visit these people. Seek professionals, because most of what they do is the more you look, the less you see. We have had them. Yes, we have had issues.
That nothing really happened.
We have. Yeah. We have had these people, they even come back to us. We have had real patients coming. We have been to these places, they offered this with exorbitant amounts. Most times I wonder, how do they convince them to pay this kind of money? Yes, they use this powder, the glaucoma is gone. And after damages has been caused, they come running back to the professionals. We have had them, and we have had cases of where we reported these people to the right authorities, and some of them, the activities was able to be nipped in the bud. But that's why we are calling on more stakeholders, especially the village chairmen, the wards, and everywhere these people penetrate. Because they go to the villagers more, the grassroots, and they offer them a lot of treatments that are not feasible. That's why we are encouraging people, please seek professional eye care. Go to your professionals, have them check your eye, so that they won't do the more you look, the less you see. In cases of this cataract surgery, I've had people couching. They move around, people tell them, we can do your surgery. Within 30 minutes, they are done. What actually happens is that most times they just displace the lens inside the eye. The person sees momentarily. Check in the next 2 months, 3 months. The lens is stuck in the eye and it's causing worse damages. You find out these people have a lot of time before they realize the damages, they have gone. These quacks have packed their things. Most times they don't stay in a place more than 1 month. Once they're done with every other thing they're doing, they move. And these people, they look for them, they don't see them. They now come running back to the professionals after the damages must have been done. These are things that could have been properly taken care of by the professionals. So this is a major quackery in this profession. And that's why we are calling on everyone to all hands should be on deck, so that we can nip this in the bud and avoid preventable blindness.
That's good. Yeah, preventable blindness. And these days, there are so many innovations based on on advanced technology that we're experiencing now. Like when you go to hospital, they tell you that they can perform operations with the robots and a whole lot of things. Is there any kind of thing like that in the eye sector? Are there any eye health sector. Are there any digital or mobile innovations that can help expand access to eye testing and treatment in this part of the world?
Very well. There are the most of the innovations here. We use our machines, still, of course, to be operated by humans for now. Although there are other innovations coming up, passing through second. We have had cases of the eye produced by recent software now, but it's still going under clinical trials, where even a blind eye can receive signals and be able to perceive. Yes, and be able to perceive the environment.
Really?
But this thing, yes, these things
They
are
will remove the blind one and put another one.
these things will be installed. It will be more like be attached, be attached onto the eye, and these sensors, these signals will be connected to the brain. As far as the retina have some healthy information, this person will receive perfect signal and be able to interpret information in the environment. So there are innovations. There are innovations. We are hoping in a few years to come we'll have more of it. When even the blind can be able to perceive, perceive the environment. Okay. But most importantly, now we are relying on machines. Machines can even be able to detect the cells in the eye in 5 years' time, what happens? In 10 years' time, what happens? Yes.
Oh, that's good.
Yes, that's why we recommend for some certain tests. These advanced tests can be able to give us a prognosis of how this eye looks in the next 5, 10 years.
Very
with
important.
Proper management.
Okay, well, about rounding off, you want to say something, just to advise our people on how well to take care of their eyes, as you have been, as we have heard in our theme that you should love your eyes. Yes, Dr. Glad.
Thank you. Love your eyes, vision for everyone. You know, loving your eyes cannot be overemphasized. The eyes is the lamp of the body. Once you lose your eye, you will not be happy forever. So I encourage every one of us, once you notice anything, run to the nearest optometrist, run to the nearest eye clinic. Let it be that you go, they will tell you, it's nothing. Yes, it's better it is detected on time than when you come, we tell you, nothing can be done again. That it is late, yes. So I encourage everybody, both small child, once your child comes to you and tell you, I can't see the board, please run to the nearest optometrist. Once you notice any form of itching, discharge, redness, run to the nearest optometrist. Let us examine your eye properly and give you the proper medication that you need. Thank you.
Thank you very much. Yes, Dr. Clara.
Okay, like I earlier said, early detection is very, very important in eye care management. Please, our people, prioritize your eye health. Very important. Usually, we advise that every person without any form of eye issue have the eyes checked at least twice a year. This is to enable the professional to have a check on the eye and be able to detect any form of abnormality. Please, let's prioritize our eye health. Desist from drug abuse. Please, any form of drug abuse. Stop running to your chemist at any slightest issue. Please, desist from traditional practices. We have mentioned them. Stop using things that are not supposed to be used on your eyes. Your eyes are very delicate. You can damage the structures, and they will lead to irreversible loss of vision. Please, take care of your eyes. Thank you very much.
Very important. Okay, the work we are taking on Saturday, from where to where can we join you?
Yes, you are very much welcome.
So where are you taking off and where are you ending?
Okay.
From Anambra to Aroma.
Oh, it's a long walk. Okay, thank you very much.
And in Onitsha also, yes, they're going to be moving from FMC there and move around the area too, so that people around Onitsha can also join. We'll have flyers to be given out during this work for sight. There are things that will be written on it. People can read through, a quick read, what you can do.
And know how to get help when you have a problem with your eyes.
This movement is it just restricted to Anambra, or you likely to see movement like this across the states?
Across the state, across the nation. Nigerian Optometric Association is nationwide. There are all activities all over the states, all over across the nation, not only in Anambra State. So we are likely going to see it in all other states too.
I see. Okay, thank you very much. That's how we are concluding it this morning. As we looked at promoting eye health and access to vision care in Nigeria, and this is to mark the World Sight Day, which has its theme as Love Your Eyes. That's exactly what we have done this morning to help you know how to love your eyes, because this is what you all live for. Okay, here it will be a story. That's when this sight is lost. It's like you've lost everything. So please don't lose it. Okay? Thank you very much, Dr. Glad Azubike, an optometrist, for joining us today.
Thank you.
Yeah, Dr. Glad, thank you for coming. And then Dr. Clara Okeke, who is the Financial Secretary, Nigerian Optometric Association, Anambra State Chapter. Thank you very much for coming.
Thank you for having me.
Okay. So maybe by this time next year, we'll also have you to tell us the progress you made this year. Okay? Thank you.